She's 68 years old, and she came to me a couple of weeks ago and said, Dr. Harris, I would like you to kind of give me a refreshed look. You know, she did not want to do something that was very invasive or that would give her a lot of downtime. So I thought, well, Botox and fillers, you know, that always works great. Hi, I'm Dr. Wix-Harris, and I'm a cosmetic physician here at Reflection Center in Martinsville, New Jersey. And today I'm going to talk about a liquid facelift transformation that we did for one of our staff members, Merrianne. So Merrianne has done both Botox and filler in the past. We actually did her lips a couple of months ago, and there's a link below here at the video if you want to take a look at that. What's very important when you do a liquid facelift is that you really have to treat the whole face. You can't just say, this part bothers me, let's focus on that, because the cheeks, the height of the cheek and the volume that you have in your cheek really determine the sagginess of the lower face. And the same thing is with the temples, you know. So when I do a liquid facelift, I always look at people in three pieces. I look at the upper face, I look at the mid face, and then I look at the lower face. And you kind of like to start from the top and work your way down. It's almost like a house, you know. When you're building a house, you don't show up and hang up curtains if you don't even have a foundation there. You have to build the foundation first, then you do the contouring, and then finally you show up with the curtains to do the refinement. So when you look at Merrianne's before pictures, you can see that she has hollow temples, saggy cheeks that are deflated and showing eye bags, and she has heavy jowls and an underdeveloped chin, and her jawline is not very defined. A liquid facelift requires a lot of filler. It's usually somewhere between 8 to 12 syringes at least. And for a lot of people that can be very daunting, and it sounds like a lot, and also it can be very costly. So what I tend to do is do it in sessions. So you start with about 4 syringes per session, and in Merrianne we started off by doing the temples and cheeks in the first session. Then we added some more filler to her cheeks in the second session, and then finally ended up doing the chin in our final session. So most people will need both the cheeks and the chin for a liquid facelift. Not everybody needs the temples. Some people need the jawline. It really depends on where people have volume loss and what their goal is. So I tend to make an individualized plan depending on the patient. I use both needles and cannulas for filler. It really depends on what kind of product it is and what layer of the skin and subcutaneous tissue it goes into, and also what are the risks. In higher risk areas, I tend to go with a cannula because it's much safer than using a needle. When I use a cannula, you have to make an entry point, and I use a very small needle to make that opening, which is the part that's the most uncomfortable part of using a cannula. And then after that, the cannula gets inserted through that tiny little hole, and most people don't feel any discomfort after that. The filler also has some lidocaine in it, which works really quick, so it really feels more like pressure and really isn't painful. I place my patients in different positions depending on the area I treat. Sometimes I'll have them sit up. That's especially important for treating the under eyes. But sometimes I'll have them reclined, like you can see here. That makes it comfortable for the patient, but it's also so I'm at the right angle to inject properly. Some areas, especially the chin, I tend to massage the area afterwards to kind of mold the filler a little bit and make sure that there are no lumps or bumps or any irregularities. It's important to make sure that you go to an experienced injector whenever you get filler. Because there are some risks to filler. Most people will have a little bit of swelling. Occasionally you'll have some bruising. The biggest risks are infection, so it's very important to make sure that we inject on clean skin and clean as we go. Also, what's very important is to make sure that you know the anatomy, because If you by accident inject filler into a blood vessel, it can have serious consequences. It can cause necrosis of the skin, which can lead to long-term complications. It's pretty rare to have a complication like that, but experienced injectors recognize it immediately and will have a plan and the materials in the office to take care of it right away before it becomes a serious issue. So these are our before and after pictures of Merrianne, and as you can see, she looks a lot better. She looks more refreshed, she looks younger, she looks less tired and saggy. If you look at her temples, it's a very subtle change, but they just don't look as hollow anymore. But it doesn't look strange or unnatural. Her cheek looks fuller. They look, not as saggy. It actually improved the way her under eyes look. She doesn't appear to have the under eye bags anymore because we kind of filled that area around it. We didn't specifically treat her eyes. We actually treated only her cheeks, but because she had so much volume loss in her cheeks, it made her eyes look baggy and worse and made her look tired. And now she just looks more refreshed. We also increased the height of her chin. As you can see before on the picture, her chin was very short looking, and that made her jowls look heavier. So by elongating her chin both in this direction and kind of pulling it forward, it just made her jowls less pronounced. Now ideally you would like to put some threads to pull the jowls too, but Merrianne really didn't want to do anything that would have some downtime. With this she had minimal downtime. I'm really happy and excited to see that liquid facelift and chin filler is starting to become more mainstream. We've known for a while that this was the correct way to do filler, but it's been hard to convince patients sometimes to do that because it's not all that well known and people are a little scared about putting filler in their chin. It sounds so weird. They're like, well, lips everybody knows and cheeks everybody knows. But you really have to add the chin to a liquid facelift to get the best results possible. If you're interested to see if you are a candidate for a liquid facelift or for chin filler only, like in our younger patients that don't have the saggy cheeks and have enough volume in their cheeks, they can do just chin filler to augment their chin or to augment their jawline. We do offer free consultation, both in person and through secure video chat. So if you're interested, just give us a call and set up a consultation.